Depression is a common illness. It affects how you feel and think. Imagine a heavy weight on your chest, making it hard to breathe. That's what depression can feel like emotionally.
It drains your energy and steals your joy. Many things can cause depression. Sometimes it's a chemical imbalance in the brain. Other times, life events like loss, stress, or trauma can trigger it. Genetics can also play a role.
Depression shows up in different ways. Some people feel sad and hopeless most of the time. Others lose interest in things they used to enjoy. Changes in sleep, appetite, and energy levels are also common.
It's important to remember that depression is not a sign of weakness. It's a real illness that needs care, just like any other medical condition.
Obsessions are unwanted thoughts that pop into your head, even when you don't want them to. They're like broken records, playing the same song repeatedly. These thoughts can be about anything, but they often revolve around fears, doubts, or worries.
The exact causes of obsession are complex. They can be linked to anxiety disorders, genetics, or past experiences. Sometimes our brains get stuck in a loop, replaying the same thoughts over and over again.
Living with obsessions can be distressing. They can consume your thoughts and make it hard to focus on anything else. Obsessive thoughts often lead to compulsive behaviors, which are repetitive actions aimed at reducing the anxiety caused by the obsessions.
Depression and obsession are distinct conditions, but they often coexist. It's like they're two sides of the same coin, each influencing the other. Imagine this. Depression whispers, "Nothing is worthwhile," while obsession counters with, "Are you sure you did everything perfectly?" This constant interplay can create a vicious cycle. Depression can fuel obsessive thoughts by making it harder to dismiss negative or intrusive ideas. The exhaustion and hopelessness of depression can make it feel impossible to control obsessive thinking. On the other hand, obsessions can worsen depression. The constant intrusion of unwanted thoughts can lead to feelings of shame, guilt, and inadequacy. This can further deepen the darkness of depression. Section 4. Finding relief. Strategies for managing depression and obsession. Managing depression and obsession often requires a multifaceted approach, like using different tools to fix a complex machine.
Therapy, medication, mindfulness, and support systems are all valuable components of this process. Therapy provides a safe space to explore your thoughts and feelings. Cognitive behavioral therapy, or CBT for example, teaches you to identify and challenge negative thought patterns associated with both depression and obsession.
Medications, such as antidepressants, can help correct chemical imbalances in the brain that contribute to depression. In some cases, medications specifically designed to manage anxiety and obsessive thoughts may also be prescribed.
Mindfulness techniques like meditation and deep breathing can help you become more aware of your thoughts and feelings without judgment. This can be particularly helpful in managing obsessive thoughts, allowing you to observe them without getting swept away by their intensity.
Section 5. The power of support, reaching out and seeking help. Remember, you don't have to face these challenges alone.
Seeking support from loved ones, support groups, or mental health professionals is crucial. Talking to someone you trust about what you're going through can make a world of difference. Sharing your experiences can help you feel less alone and reduce feelings of shame or isolation.
Support groups provide a space to connect with others who understand what you're going through. They offer a sense of community and shared experience, which can be incredibly validating and empowering. Section 6. A brighter tomorrow, hope for healing and living fully. It's important to remember that there is hope. Depression and obsession are treatable conditions.
With the right support and strategies, you can regain control of your thoughts, emotions, and life. Recovery is not always linear. There may be setbacks along the way. It's essential to be patient with yourself and celebrate small victories.
Remember, seeking help is a sign of strength, not weakness. By reaching out and taking steps towards healing, you're making a powerful choice to reclaim your well-being and live a life filled with joy, purpose, and connection.